As of tomorrow, it will be 3 months since I declared a public health emergency of international concern over the outbreak of novel coronavirus. Today, I would like to take a few moments to look back at the period preceding that announcement to be clear about what WHO knew and what we did, which could help the country to understand the 3 months. On the 31st of December, WHO's Epidemic Intelligence System picked up a report about a cluster of cases of pneumonia of unknown cause in Wuhan, China. The following day, New Year's Day, WHO asked China for more information under the international health regulations and activated our incident management support team to coordinate the response across headquarters and our regional and country offices. On the 2nd of January, WHO informed the Global Outbreak Alert and Response Network, or GORN, which includes more than 260 institutions in more than 70 countries. Yesterday was GORN's 20th birthday, and I would like to use this opportunity to say happy birthday to GORN and thank you and congratulations to every single GORN member for their commitment to responding to the COVID-19 pandemic and many other emergencies. We're really proud to work with you. On the 3rd of January, China provided information to WHO through a face-to-face meeting in Beijing and through WHO's event information system established under the international health regulations. On the 4th of January, WHO reported the cluster of cases on Twitter. At that stage, no deaths were reported. On the 5th of January, WHO shared detailed technical information through its event information system. This included advice to all member states and IHR contact points to take precautions to reduce the risk of acute respiratory infections, providing guidance on the basis that there could be human-to-human transmission. On the same day, WHO also issued its first public disease outbreak news, publishing technical information for the scientific and public health communities, as well as the world's media. On the 10th and 11th of January, WHO published a comprehensive package of guidance on how to detect, test for, and manage cases and protect health workers from potential human-to-human transmission based on our previous experience with coronaviruses. We also published a readiness checklist to help countries assess their capacities and gaps for detection and response. Because Wuhan is a major domestic and international transport hub, WHO also advised that the risk of cases being reported from outside Wuhan was increased. On the 11th of January, China shared the genetic sequence of the virus for countries to use in developing testing kits. On the same day, China reported the first death from the new coronavirus. On the 13th of January, the first case was reported outside China in Thailand. That day, working with partners, WHO published the first instructions for how to make PCR-based diagnostic test kits, enabling the world to find cases. And I would like to use this opportunity to thank Germany. On the 14th of January, WHO tweeted reports from China that preliminary investigations by Chinese authorities had found no clear evidence that human-to-human transmission was occurring. This is in line with our practice of reporting to the world information that countries report to us. we post countries' reports as is. However, earlier the same day, WHO held a press briefing at which we said that based on our past experience with coronaviruses, human-to-human transmission was likely. And our senior experts participated in that press conference. And that news was carried by mainstream media. On the 20th and 21st of January, WHO staff visited Wuhan. And on the 22nd, reported that the evidence suggested human-to-human transmission was occurring. On the 22nd and 23rd of January, I convened the emergency committee consisting of 15 independent experts from around the world. At the time, 581 cases had been reported and only 10 cases outside China. The emergency committee was divided in its opinion and did not advise that I declare a public health emergency of international concern. The committee asked to reconvene in 10 days or less to allow time for more information and evidence to be collected and considered. On the 27th of January, I traveled to Beijing with WHO's Chief of Emergencies, Dr. Mike Ryan, and other senior WHO staff, and met with President Xi Jinping and other leaders to learn more about the response and offer WHO's assistance. We discussed the seriousness of the situation and agreed that an international team of scientists should travel to China to look into the outbreak and the response, including experts from China, Germany, Japan, the Republic of Korea, Nigeria, the Russian Federation, Singapore, and the United States of America. On the 30th of January, I reconvened the emergency committee, and after receiving their advice, because of the new information they gathered, they had a consensus, I declared a global public health emergency, WHO's highest level of alarm. At the time, as you may remember, there were less than 100 cases and no deaths outside China. To be specific, we had 82 cases outside China and no death when we declared the highest level of global emergency. From the beginning, WHO has acted quickly and decisively to respond and to warn the world